Afternoon. Steve Alquist of Uprise RI is relaying a question from a frontline medical caregiver. Is the state providing any programs for struggling healthcare workers to support their mental health care?
Yes, so we are, and I'll take a second to go through that. If you have a mental health care provider already, it's important to know that through an executive order, I have mandated that telehealth, calling them, is covered and covered in the same way as an in-person visit. I've also required insurance companies to waive pre-authorization so you can have quicker access to your mental health professional. If you don't have someone now, you could call BH Link, 414 Link, and that they will facilitate you so that you can find the right level of care that you need.
Our next question. Our questions are coming in real time from reporters all over southern New England. And the next is from Ryan Belmore of What's Up Newport. Governor, yesterday during the press conference you said that when schools reopen, it would likely be with smaller class sizes. With many school districts facing huge budget issues, how can they afford the personnel to allow for smaller class sizes? Additional state aid, he asks?
Yeah, so all to be determined. I'm trying to get through phase 1, which is to give everyone a flavor for it, a whole new set of guidelines, new sets of regulations, new sets of enforcement. That's phase 1. Then we'll get to phase 2. Reopening schools is like phase 3 or 4. So we'll have much more to say about that, later. But it's going to be different. I don't know how it's going to be, but we're going to have to rely on technology. We may have to use some of our we will have to use some of our COVID relief funds to help schools in order to meet the necessary cleaning requirements. So it's going to be a whole new day in schools when we reopen, and I'm not prepared today to talk about exactly how.
Eli Sherman of WPRI Channel 12 says, yesterday the health department revised its data to show there were about 70 more hospitalizations than originally counted. Were you surprised by that change? And has that uptick changed the calculus behind your willingness to reopen the economy after May 8th? Why or why not?
The governor was aware of this change, as we've explained it, and it does not shift the overall timing for reopening. What we did with our system is take what was established during the throes of this epidemic very early on, where we had a comprehensive way engaging our infectious disease docs and infection control practitioners at each of the hospitals to collect information on hospitalizations. And that's how we were reporting out what our hospitalized cases were. As the number of hospitalized cases continued to grow, we have developed a process to allow for a more streamlined electronic submission approach to those hospitalized cases. And in doing so, we learned of some additional cases that may not have been captured by the providers who we were getting the information from. And part of that may be because there have been some hospitals that have started to screen all patients now for COVID-19. And so our streamlined electronic submission allows us to capture all of that more confidently now. We very much appreciate the extensive resource-intensive work that had been done previously, and we now have a solid way for continuing to collect it going forward through our system. That being said, that helped us identify a certain number of hospitalized cases. The increase that has occurred also may be due to an actual bump in hospitalized cases. It may be partially the screening that I've just mentioned, that we are now identifying more people who are in the hospital with COVID-19 as opposed to just people who are in the hospital because of COVID-19 or for COVID-19 related illnesses. Someone could have a sprained ankle, and if they are screened for COVID-19 and their test returns positive, they may be in the hospital with a sprained ankle with COVID-19. We want to make sure that we are capturing that data as well. That could contribute to some of the bump, or the fact that during the holidays earlier in April, when the weather was nice, some additional people did get out into the community. 10 days later or so is when you would see the change in numbers in our data because of the amount of time it takes for the infection to evolve. And that may be contributing to a little bit of that shift that we have in the numbers. So it's critical for everyone to understand, as the governor just said this morning, our numbers and what we are seeing is very sensitive to what you were doing in following the stay-at-home order.
Governor, do you have anything to add?
The question was directed at me, so I'll offer a few thoughts. I was not surprised. As the doctor said, I've been kept informed on a daily basis. It is, I think, good news insofar as it's a more accurate portrayal, not good news insofar as I keep waiting for the day when we see a decline. But as I said, we're not going down. We're not yet going down the curve. But it's still consistent with the plateau. And if between now and May 8th, that plateau continues and all the other benchmarks are met, then I will feel comfortable. If, however, it's not a foregone conclusion that May 9th we're going to start phase 1. If, however, we start to see an uptick, any concerning data, another one, I'm worried about vulnerable communities, our testing isn't where it needs to be, our contact tracing isn't where it needs to be, we have an outbreak someplace, well, then we're going to have to pause. So we're still in a mode of managing a daily crisis, and flexibility is going to be key. But as I stand here today, based on everything I know and my faith in the people of Rhode Island to obey the stay-at-home order, we are planning for lifting the stay-at-home order on May 8th.
Christian Winthrop of Newport Buzz asked you, Governor, when you make further beach announcements, will state, town, and private beaches all have the same rules? Can town beaches impose different restrictions than state beaches, such as residents only?
Excellent question. Yes, they can, and they may. It's my hope that we, the state, will be able to provide them very quickly with guidance, and that they would look to follow that guidance so we have a uniformity across the state. Having said that, you've seen in Providence already that the mayor took a different approach than I took for the state, which is fine. So we're going to give them guidance. In fact, just yesterday I had a call with all the municipal leaders. We're trying to stay ticked and tied together, but they are absolutely able to do different regulations if they decide, maybe someone thinks it has to be more stringent based on what's happening in their community.
Brian Crandall of NBC 10 asks, will there be an overall capacity limit at parks and beaches when they reopen, or just enforcement that people stay 6 feet apart from each other, especially at beaches where people typically sit down for a while? Will they be spaced out?
So, Brian, I'm smiling because these are exactly the sorts of questions that are consuming us day and night. And sadly, my answer for you is I don't know yet. But the goal is to make sure everybody stays 6 feet apart, to make sure that we're not spreading the disease between one another. And then the question becomes, okay, well, how do we achieve that goal? And it's almost certainly going to be the case that there are going to be overall capacity restrictions, because it just isn't realistic to expect that people will be able to stay 6 feet apart unless you restrict capacity, much as we're doing now with grocery stores. The goal is 6 feet apart. The only way you can achieve that goal is that there's fewer people in the store at any one time. So all of the work that my team and I are doing right now is to figure out questions exactly like this. How do we change the rules and regulations and then enforce those new rules and regulations so people actually stay 6 feet apart, continue to wash their hands, continue to wear their masks, we continue to protect the most vulnerable, and there's a whole bunch of different ways that we can do that.
Richard Asnoff of Convergence RI asks, what kind of testing regimen does the Department of Health envision will be necessary after the stay-at-home order is lifted?
Thank you, Richard. There is extensive work also going on how to approach testing. One is to make sure that we understand that testing is going to be one critical tool in the full toolbox of how we will approach reopening the economy. It is not a replacement of what the governor just mentioned, the staying 6 feet apart, making sure people have access to hand sanitizer, washing their hands, being able to cover your face and nose to prevent spread to people who are around you. Those components will need to be in place along with the testing component. From our testing standpoint, we have 3 general categories. One is going to be continuing the aggressive approach we're taking with clusters of cases, similar to what I've shared how we are approaching it in congregate settings. If we have a cluster of cases in a congregate setting where we know it's a medically and physically fragile community and the virus can spread more easily, we are very aggressive in testing the staff and the residents in that entire home. We'll want to do the same in certain communities where we're seeing higher numbers. If there's one case in a housing unit, let's go and test the entire housing unit and see how we can help and provide the support that's there. Another approach that's going to be critical is what we are calling sentinel surveillance. It's an ability to use testing to help understand what's going in different sectors of our society, in some of our workforce sectors, some of our retail sectors, and in some communities that we are in. The third category is going to be continuing to have a focus on our high-risk communities. Those who are, we know have had higher rates of numbers, and making sure that we have the services in place to support them once we do the testing and activate the contact tracing and subsequent components.
Our next question is from John DePietro. Governor, why not treat high infected areas in the state and residents in those areas differently than other areas? Why treat Block Island, Narragansett, and Newport the same as Providence, Pawtucket, and Central Falls? Will any stimulus money go to undocumented people?
Okay, that's a lot of questions.
2 different questions.
Leave it there so I can keep my eye on it. So in some ways we are treating different communities differently. For example, we have a walk-through clinic in Central Falls. Why are we doing that? Because we have reason to believe that in that community there's a high incidence, people haven't been tested, they don't have cars, they can't get to Twin River, so we went to them. Same thing for Woonsocket and Oneyville and other areas in Providence. In other ways, it just doesn't make sense. You know, in a much bigger state, that might be something that we could do. Like, for instance, I know in New York, which is a much bigger state, obviously New York City is very, very different than some of the upstate, more rural parts of the community, and people don't interact. Rhode Island is, as you know, as we all know, it's a small place. It's extremely densely populated. I think we're the most densely populated state in the country. You can get almost anywhere within an hour, which is one of the reasons we love it, but it means that it doesn't really make sense to have different, like county by county regulations, and frankly, it would be very difficult to enforce. So that's why we've made the choices that we have made. We haven't yet decided about the answer to the undocumented population. Here's what I will say. I'm concerned about it. I am quite concerned about it. Folks who are undocumented are afraid, and they're afraid to get tested. They're afraid that when they go to a testing site, there might be an immigration official there. We are working overtime to let the community know that's not going to happen. They should get tested. They should see a doctor. They should see a doctor if they're sick. If they need a place to live, if they're a healthcare worker, they should let us get them to Brown University. And so I'm worried that because they're afraid they're not going to get the care they need, they're going to continue to spread the disease, which is bad for everybody. So I want to make it clear, regardless of your political views on immigration, I promise you it's in the interest of every Rhode Islander, in the public health interest of every Rhode Islander, that everybody gets tested and is logged in our contact tracing system and gets the support that they need. And so how we do that exactly is an evolving thing, but we're working on it every day.
Our next question is from Alex Weldon at WPRO Radio. Mass allows greenhouses to be open with all social distancing. Your 427 order does not effectively allow garden centers to gain any ground. They are selling and the customer service process is stifled and counter to social distancing. Can you revisit this?
I believe we'll be making announcements on Monday related to exactly that question. So if you can hang on for a few days, I can come back to you.
And our last question for this Friday is from Stephen Triedman of Eastside Monthly. Tomorrow in Providence, Mayor Lorza is closing selected streets for people to walk and exercise and opening some parks as well. The majority of these are in the highest COVID-19 affected areas. Are you concerned about an increased spread? And does your May 8th day loosening of the restrictions tie into this?
So a key for everyone is definitely going to be making sure, as you're getting outside during this stay-at-home order, that it is done safely for a short period of time and people return. That masks, face cloth coverings are worn, covering your mouth and your nose whenever you're outside in public. That 6 feet of distance is used with other people in the public setting, so you're minimizing spread of infection or risk of spread to anyone else. And as often as possible, particularly if you need to touch a surface that the public touches on a regular basis, a doorknob, a countertop, that you have hand sanitizer and or access to washing your hands, and you're doing that. With those set rules in place, being able to take a walk outside is important for our own health and well-being. And so as long as folks follow the stay-at-home order and those social distancing guidelines that I just shared, our ability to keep an increase from happening is possible. But if people are not following those guidelines, then yes, there would be concern with more people getting out and increasing the risk of spread. We understand the importance of enjoying some of the weather, but it is key that everyone follows the stay-at-home order and how to do that. Go out quickly, come back, and be able to stay at home, and do it safely if you do go out.
Thank you. Do you want to add anything?
I would agree with that. I would just end by, I agree obviously with everything she said. This is a big weekend, so I respect the mayor's decision to go ahead and do that. People do deserve the opportunity to go outside, but I know the mayor is planning to make sure that social distancing and mask wearing is enforced. There is still no congregating outside. You go outside alone or with someone in your family, go for a walk and go home. The stay-at-home order is in full force and effect, and we're going to be out there enforcing it, as well as the mayor and the Providence Police. So, and then does the May 8th loosening, I'm not sure what that is, but you know, obviously if we get to May 8th and we lift the stay-at-home order, then people will be freer to go to parks, and it's possible the mayor would consider reopening parks at that time.